My name is Tozo Mkize. I'm a third-year student doing welding engineering. I'm 22 years old. I'm HIV positive. I was born infected by HIV.
This South African was orphaned by AIDS when she was a young child. Today, the welding student leads a vigorous life and hopes to start her own company in the coming years. Her life would have been unthinkable in the early years of HIV/AIDS, but it became the reality for millions around the world, thanks to remarkable, some say magical, breakthroughs in treatment and equitable access. After several years of struggle in the fight to contain HIV/AIDS anywhere, a new era emerged in the late 1990s as science fought back and began winning with major advances.
They're nothing short of breathtaking, and you could talk about multiple aspects of science, fundamental basic science, pathogenesis, epidemiology, treatment, prevention. The one that obviously stands out, that's the game changer, is the development of treatments.
Treatments leapfrogged from an early reliance on AZT, which carried significant side effects, to the introduction of combination antiretroviral therapies beginning in 1996.
We learned very quickly early on that when we used one medicine, 2 weeks later patients were resistant to that single medicine. When you used two, it probably took 6 months. It's until we understood the dynamics of the virus, how fast it replicated, the fact that it was a quasi-species, and that we had to bring the viral load down quickly with a broad spectrum or a combination of medicines, and we could drop the viral load to zero, keep it under control. At that moment we made a big breakthrough.
That has been shown now to be the key to ending the epidemic, because treatment not only saves the lives of the individual who are infected and who you are treating, but it also, if you bring the viral load to below detectable level, makes it essentially impossible for that person to transmit the virus to their sexual partner. So we now have a tool, a game-changing tool, is the extraordinarily effective therapies that we have.
These historic scientific advances did not occur in a vacuum. The devastating threat posed by the pandemic broke down the normal barriers to scientific cooperation. Amid intense pressure, an unprecedented level of collaboration arose across industries, regulatory agencies, foundations, research universities, advocates, and patients who demanded their place.
I must say patient involvement in this case was completely different. Patients were sitting on their protocol committees, they were sitting on the ethical committees, they were at all meetings, they were involved, and having patients present when you're working on a disease is something like, it makes it an urgency, because you have to get this drug to keep these people alive. And that was, I think, a big motivation for everyone.
In the early years of ARTs, as the pandemic was escalating in Africa and threatening to devastate societies, these game-changing therapies were beyond reach due to their staggering costs. In 1999, the disease became the continent's #1 killer. By 2002, life expectancy in sub-Saharan Africa dropped from 62 years to 47 years because of AIDS.
One of the most vivid memories I have is being in Uganda, in Kampala, the capital city, and coming in from the airport, which is a long journey, and looking at the rows of coffins lining the road. It became a big business to be a coffin maker because so many people were dying of AIDS. And when you see them lined up off into the distance, suddenly the toll is right in front of you. And you saw that in country after country after country, that the threat to those people in those communities was absolutely overwhelming.
From the mid-1990s into the next decade, the international debate intensified over what needed to be done to address this expanding crisis. In 1994, UNAIDS was founded. Its first leader was famed microbiologist Peter Piot.
AIDS and the treatment that is now becoming available is actually adding to the inequalities in the world. Having AIDS by itself is a tragedy. Having AIDS when you are in Vietnam or living in Zambia makes you really desperate, no access to even the most basic type of care.
And the United States government, in an unprecedented move, declared AIDS a national and global security threat.
Today, in sight of all the world, we are putting the AIDS crisis at the top of the world's security agenda. We must talk about AIDS not in whispers, not in private meetings alone, in tones of secrecy and shame. We must face the threat as we are facing it right here in one of the great forums of this earth, openly and boldly with urgency and compassion.
That alone was not enough to get much-needed treatment to the world's most vulnerable populations, as most drug companies' treatments for a single patient cost upwards of $10,000 a year. Activists mobilized an international campaign that pressed pharmaceutical companies to move to radically lowered prices and access for millions.
The year 2000 was a turning point. The Durban International AIDS Conference seized the world's attention on the moral urgency of affordable access to antiretroviral therapies. Prices had to drop and solutions had to be scaled. That same year, the G7 summit laid the groundwork for the launch in 2002 of the Global Fund to fight AIDS, tuberculosis, and malaria.
Meanwhile, HIV/AIDS continued to be on the national security agenda into the administration of George W. Bush. After September 11th, U.S. national security officials concluded that HIV/AIDS and other dangerous infectious diseases could cripple states, societies, and economies, which in turn threatens the national security of the United States. At the State of the Union address in January 2003, President Bush announced the most sweeping initiative ever to battle an infectious disease.
Seldom has history offered a greater opportunity to do so much for so many. We have confronted and will continue to confront HIV/AIDS in our own country. And to meet a severe and urgent crisis abroad, tonight I propose the emergency plan for AIDS relief, a work of mercy beyond all current international efforts to help the people of Africa.
The initiative won critical support from Christian conservatives, including Senator Jesse Helms.
The American evangelical community witnessed its evangelical partners in Africa decimated by the HIV/AIDS pandemic. They stepped forward. They became active. They added a critical new element to the American coalition, calling for U.S. global leadership on HIV/AIDS, and they applauded President Bush when he urged his fellow G7 heads of state to join the United States.
Global financing for HIV/AIDS tripled from 2000 to 2008, and the number of people on antiretroviral therapy jumped nearly tenfold during the same period. This transformation saved millions of lives.
The magic years were a historic response to a dangerous pandemic. They created PEPFAR and the Global Fund, two monumental structures which for 2 decades now have guided the global response. However, the remarkable energy and the dramatic growth of resources could not be sustained indefinitely. The threat subsided. Success in controlling the pandemic actually weakened resolve. The 2008 recession intervened, and in the meantime, the struggle for a vaccine and a cure continued. As 2021 opens, as we continue to face the crisis of the COVID-19 pandemic, we need to remind ourselves of the magic years and what they taught us. Success in responding to the global HIV/AIDS pandemic rested on U.S. global leadership in alliances and partnerships with others against a shared global health security threat. It rested on the belief that we had to address the threat faced by the weakest and those with the least capacity and means. It rested on a faith in science and public health. It rested on a common humanity and strategic purpose. Tragically, these historic U.S. achievements in battling HIV/AIDS seem to have been forgotten up to now in the U.S. response to the COVID-19 pandemic.